Next, we are going to hear from New Zealand Outdoors Party, and I believe that we're expecting the co-leader Sue Gray for 10 minutes.
Sue Gray here. I'm co-leader of Outdoors Party with Alan Simmons, and the Outdoors Party is very strongly opposed to this legislation. The situation now is very different from May 2020 when the emergency legislation was passed. We now know a lot more about COVID, and we know much better ways of managing it. We do not need this extended legislation. By way of my background, I'm a lawyer, a self-employed lawyer. I specialise in emerging issues. I have a Bachelor of Science degree with a double major in biochemistry and microbiology. I went to school with Chris Bailey back in Nelson years ago. I've also got a background in public health, environmental management, worked for the Department of Health for many years, and I've got a lot of expertise in COVID over the last few years. I acted in the Ngāi Kātiaki Tukuihu legal challenge in the High Court, which resulted in Parliament changing the law in 24 hours within the High Court decision coming out. Bad legislation, bad reform, and actually misleading to claim it was a technical breach because that medicine failed the criteria under the Medicines Act for approval of a new medicine. MedSafe decided that the risks of the medicine did not exceed the benefits, and it was available only for provisional consent because they didn't have the data on safety, they didn't have the data on efficacy, and they didn't have the data on product integrity. So all that was approved was for a limited number of patients. We won in the High Court and established that all of New Zealand over 16 was not a limited number of patients, and then Parliament changed the law. Now it's got worse in reliance on this COVID reform, these no jab, no job laws. When we went to court in May this year, it was voluntary whether or not to have the vaccine. Now people are losing their jobs for not having a vaccine that is not safe and is not effective, and is so contrary to fundamental human rights. We're back in the High Court next week on Thursday and Friday, challenging the no jab, no job law on a number of human rights, Bill of Rights grounds, where we say that the minister exceeded his powers and the minister did not act reasonably. Now, just by way of background, we keep hearing this mantra that it's safe and effective. That is a lie. Over 204 New Zealanders have died after receiving the Pfizer vaccine. Now, this is a record that we have obtained from a People's Register where family members, neighbours and friends have contacted us with that information. It's not getting onto the public CALM register because that is only a passive register. It doesn't follow. It doesn't actively follow up these cases. So the actual human toll is very severe. The effectiveness is not good either. The government's chief scientist, the Ministry of Health chief scientist, Dr. Ian Town, has sworn affidavit evidence saying the government has no evidence that the Pfizer vaccine prevents transmission. What is the point of forcing a dangerous vaccine that's still being experimented with, that doesn't qualify for full consent, on the entire population of teachers, border workers, health workers, when it doesn't even prevent transmission? There are two stories going on here. There's a public propaganda story that's coming out of some sections of government, and there is the real factual evidence that everybody's being told not to read. It's a very, very serious situation. Now, the COVID Public Health Response Act, as it stands already, is facilitating this situation. What you're proposing to do with the amendment is make it even worse. You're giving yourselves more powers, you're giving the minister more powers for another year. Now, what we know from the research around the world is that there is so much that can be done to manage COVID. The only people who die of COVID are people who are very frail anyway, or where there's medical misadventure. Healthy people don't die of COVID. Its total death rate is similar to the flu, but where with the flu there's much more of an array of deaths. With COVID, it's old, frail people. Now, it's sad that anybody dies. We don't want anybody to die, but the reality is old, frail people will die.
So can I just get you to speak to, can I just get you to continue to speak directly to the bill? I think you're a little bit out of scope in terms of your expertise about making those sort of clinical medical sort of assumptions. So if I could just get you to come back to the specific clauses in the bill that you want to submit on.
With respect, these things need to be said, because they're not being said anywhere else. And I am more qualified than anybody in New Zealand to put this together. I've run 2 High Court cases. I've been working with expert evidence. I've been speaking on international networks around the world with the leading experts on these cases. This is a serious problem that needs to be addressed, not fobbed off. It's not good enough to keep trying to close it down. Your job is to represent the people of New Zealand, to listen to the expertise of the people of New Zealand, and not to just stick to an agenda that we do not support. I don't know how many submissions you've had on this bill, but I can guarantee that there are far more people opposed to what you're proposing than who are supporting it. There's no question. I've been absolutely inundated with members of the public begging me for help, just like the woman who was on before. People losing their jobs, people all over the country who have done nothing wrong, who have turned up for work loyally every day, and who are losing their job because of these laws that are unconstitutional laws. Now, in New Zealand, we were taught at law school that Parliament does have sovereign power, but all power is subject to abuse, and all power must be subject to constraints. Now, the power that's exercised by Parliament must be exercised in accordance with international law principles, the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights. There are all sorts of international agreements on experimenting on people. The Nuremberg Code, which is not adopted into the law of New Zealand, but is customary international law. You cannot experiment on people. Well, that is what this COVID law is doing. And if you extend it another year, that is what it is going to continue to do. We need to look instead of going down this path, because all that the law has done so far is that it has postponed COVID. We've had 1.5 years of misery, economic, social, mental health misery for a lot of people, and all it's done is it's postponed COVID hitting New Zealand. We still have to go through COVID. And we go through COVID with our economy depleted and our mental health depleted before we even start. So what we need to do is look at better ways of managing this. We had perfectly good rules in the Health Act before we started. And we've got perfectly good rules that are much more balanced, proportionate rules that respect the human rights provisions of our laws. That is what the Outdoors Party stands for. It stands for respect for freedom, respect for alternative views, listening to the people that elected representatives are supposed to be representing, and not listening to external forces or a handful of people who are trying to manipulate the way things are done and exclude the alternate voice, because there is never only one source of truth in these things. If anybody ever claims there is one source of truth, you can rest assured that they don't know what they're talking about, or they've got their own agenda. There is so much alternative views, the ivermectin, the vitamin D, the hydroxychloroquine. Don't shrug, please. It's true. If you look at Uttar Pradesh in India, you will see that they went from a very serious outbreak of COVID. It was controlled within a week. And what they did, they handed out a kit to every person in the state with vitamins and ivermectin. COVID was cured. It was managed. Now, that is the type of solution that we should be looking at in New Zealand, not extreme reliance on experimental drugs, that even the person that supplies them doesn't trust that they're safe and effective and demands an indemnity from the government of New Zealand. Why would we trust something that the supplier themselves doesn't claim is safe and effective? Read the safety data sheet, it's on MedSafe. Read the risk management plan, it's on MedSafe. Look at the effects of the lockdown And all it does again is delay the problem. So all of these steps that are being taken under the COVID health response bill are just delaying the problem. They're not addressing and managing the health of New Zealand. Let's look at enhancing our immunity so that we are all more healthy, that we're all much stronger and fitter and able to cope with all disease. We can't just focus on one thing. Far more people are dying of road accidents and strokes and heart attacks and cancer than are dying of COVID. We've got everything so out of proportion. So it's time for you, who are our representatives, to make a stand on behalf of us, to actually do the right thing and reinstate human rights, reinstate proper processes. This is the fastest I've ever seen a bill go through Parliament. It was closed on Monday's submission. You're hearing it today, and no doubt the law will be in next week, sometime around my court case. You know, it's not how things need to be done. It's far, far, far too serious for that. So I do thank you for hearing the submission today. I'm very, very grateful that you do that. And I do understand it's really hard because you've got a lot of very frustrated, upset New Zealanders who are losing confidence rapidly in democracy in our country. And you have a chance, you have a huge opportunity to help reinstate that public confidence. But what it will take is for you individually and together to make a stand on behalf of the people that you were elected to represent. So I'm very grateful for the opportunity. I'm willing to answer any questions, and I do thank you for your time.
Okay, thanks very much. That's time, so I don't think we've got time for any questions unless anybody had anything that was a burning question. I don't see any hands up. Great. Thanks very much for your time, Sue.
Thank you.